Welcome all to PolitiFest 2020, Pick Your Future. I'm Lisa Halverstad. I'm a reporter for Voice of San Diego, and I'm lucky enough to know all the panelists today. I think it's going to be an interesting panel here. We're so glad to have you with us today. In case you are not familiar with VOSD, we're a nonprofit investigative news outlet committed to holding local leaders accountable and giving you the information that you need to make important decisions and advocate for the public good. As a nonprofit, we do just depend on members and donors to make this work possible. We thank you for your support. I'd also like to take a minute to recognize our sponsors who help make PolitiFest possible. Special thanks to Google News Initiative for supporting the creation of this virtual event, to the College of Arts and Sciences at USD for underwriting all our student tickets, and to the San Diego Foundation for supporting our community conversations, including this one. Also, thank you to Cox Communications, SDG&E, the Atlantis Group, the City of San Diego Retired Employees Association, City Heights CDC, the San Diego County Democratic Party, and Business for Good. And again, special thanks to the San Diego Foundation for supporting this panel and the other community conversations we've had during PolitiFest. There have been lots of sessions, and we know that you likely were not able to attend all of them. So luckily, you will be able to watch recordings of all of them on our site. Recordings will be available by noon the following day. You can also use the online event guide on CVent to connect with other attendees and learn about other speakers and sponsors we've had. And also be sure to get your own VOSD mug or drinking glass. I'll include some links in just a moment in the chat. Before we get started, I know the team working on this panel would want me to encourage you to share your comments and questions. They'll be watching those throughout the panel. And then answering some questions. They'll be taking the lead on that and selecting the questions. As a reminder, everyone's camera and mic except for the moderator and the panelist is turned off and muted. You can also tweet along with this session, which I know our panelists would also enjoy, by using the hashtag PolitiFest2020 on social media. And now, without further ado, I'll pass the baton over to Omar Passons. Thank you.
Thank you so much. This is going to be an informative and important hour, and we're all excited to be here to share. My name is Omar Passons. I am the Director of Integrative Services in the county's Health and Human Services Agency. I want to frame a little bit of context, and then we'll get right into questions for our panelists. It's important to understand that the county of San Diego is massive. Often, folks that are engaged at the city of San Diego level are aware of that, but there's 4,200 square miles, 1.4 million acres of parkland, over half a million people in the unincorporated area, which, just for context, it's the second largest municipal area in the region to the city of San Diego, which means the county government is solely responsible for all your basic services, but also for working with and helping to house those experiencing homelessness in those unincorporated areas. So we've got everything from providing support to the Encinitas Hope Team, as an example, to the Spring Valley Threaded County Outreach Team, which includes parks and Sheriff's Heart deputies and on down across the entire region. Because we're in a pandemic and folks recognize that that's a backdrop for a lot of this conversation, I want to just also sort of highlight that the county's COVID response, together with many, many partners, has distributed nearly 13,000 prevention and sanitation kits across the region to people experiencing homelessness. And I'll just say that the convention center effort that many are familiar with, and you'll probably hear some panelists talk about, has been a lockstep partnership with County Health and Human Services Agency. So that's just some context in terms of understanding some of the response. And so what I'd like to do is we're going to go for about a half an hour, 40 minutes worth of back and forth. The panelists will be able to respond to one another. They're going to try to keep their remarks to about 1 to 2 minutes and allow for some back and forth. We're going to leave probably 15 minutes of this session for your audience and viewer questions. Our sort of unseen partner, Zach Schlegel, from PATH, is actually monitoring the questions, so that even, you know how Zoom chat works, it can get buried a little bit. And so if there's a good nugget, we'll try to make sure to pull those out and get those questions asked. And so without further ado, we do have 4 great panelists, and they know themselves as well as anybody. So rather than read their bios. I'll just give you their names and we'll jump into questions. And then I'll just ask the panelists, as you go to answer that initial question, if you can just give a little bit of a snapshot of who you are and the work your organization does, and then answer that first question, and we'll roll on from there. I'll try to, be careful about not stepping over each other, but it's Zoom, so we'll just all have to be a little bit gracious with one another as we go. So with that, Jonathan Castillo from PATH, Jim Floros, the CEO of San Diego Food Bank, Deacon Jim Vargas, the CEO of Father Joe's Villages, and Rebecca Louie, Vice President at Wakeland, will all be able to weigh in for themselves here shortly. And so let's go ahead and get started. And the first question is actually for everyone, and we'll start with Deacon Jim, and then just go right on down. What is one thing in your work that has surprised you since the pandemic with regard to homelessness? Deacon Jim?
Thank you, Omar. And thank you, each and every single one of you who've taken the time to attend this afternoon. I'll start, as Omar mentioned, by telling you a little bit about Father Joe's Villages, very little, just to say this is our 70th year. We're the oldest homeless services provider in Southern California, and we've been providing an array of services from healthcare, of course, to food and shelter. We build affordable housing. We have a therapeutic child care center. We'll get into some of these aspects a little later, I think, with Omar's questions. But we provide a full array of comprehensive services, not only to take people off the streets, but to help them to stay off the streets. That's in a nutshell what Father Joe's Villages does. To your question, Omar, I think what's become quite evident during this pandemic is the health services, obviously. That's front and center. And we've always been very cognizant of health because of our population. They're at high risk. They're more vulnerable because of weakened immune systems. Typically, a lot of them are older, they've been chronically homeless. And so the screening that we've done, the preemptive testing and screening, has served us extremely well. At Father Joe's Villages, those who have tested positive have been less than 1%, which is phenomenal, actually. And that's a tribute to the protocols that have been put in place, whether it's mask wearing, sanitation is a very big piece of it, social distancing, and just raising the consciousness level of everyone. And so that's been very key for us. And that's been, I don't know about an eye-opener, because as I mentioned, health is always front and center for our population. The other point that I guess I would raise in answer to your question has to do with how precarious especially our population is as it relates to their level of income. And so they've been hit hard. Many of our clients do work. Some of them have more than one job, actually, but they're underemployed. It's very expensive to live in San Diego, as we each know. And this has really been front and center during this pandemic, because a lot of them have lost jobs. And so their situation has even become worse. And 60% of the tenants' households, actually, I've read recently in a Los Angeles study, have not been able to pay rent, and have at least missed 1 to 2 monthly payments, actually. And this is going to catch up with them. It's going to catch up with all of us. So, these are individuals that are poverty is a very big deal, obviously, in their lives, and they have low wages. And this is really this has just impacted them even more during this time.
Thank you for that comment, Deacon Jim. It's a good start to level set, really thinking about poverty. You'll notice Lisa mentioned in the lead-in that there's a tweet thread, actually. If you go to my Twitter, you'll find probably a started tweet thread already that includes the difference between federal poverty level, supplemental poverty, and even the elder index, which we'll maybe get a little bit more to. So very big differences in the amount of income needed to survive in a place like San Diego. Jonathan, turning to you and PATH, please introduce yourself, introduce the organization, and then what surprised you about the pandemic as it relates to homelessness thus far?
Good morning, everyone, or it's good afternoon now. Like you said, my name is Jonathan Castillo. I'm the Chief Regional Officer with PATH, and we've been in San Diego for 7 years, but we've been providing services to people experiencing homelessness throughout the state for the last 37 years. Just a little overview of what PATH is, very similar to Father Joe's Village. We provide services to people experiencing homelessness, and we have a very diverse portfolio of services because we believe that Everybody that experiences homelessness is for a very unique and specific reason. So we need to make sure that we have as many different types of services in our toolbox so we can respond to those individual needs. I think something that has really stood out to me, when the pandemic first began, the National Alliance to End Homelessness released some data that showed some pretty concerning numbers, or some research that showed that it was anticipated that people experiencing homelessness were 4 to 5 times more likely to show the more serious symptoms of COVID, and were 2 to 3 times more likely to die than the general population. And so I think what really drove the homeless service providers to have such a strong response is that we knew that the people that we were serving were far more vulnerable. And when there was a lot of concerns about how is it transmitted, my concern as a service provider is how is this going to impact not only the people that we serve but our teams, our employees. And I think that we mobilized, and I think that's one of the things that really stood out to me is not only did our organization mobilize, they really rose to the occasion to make sure that they were serving the people that need us the most during a scary pandemic, but our communities mobilized. And if Father Joe's Village and Alpha Project and the county, everybody came together in a very urgent and coordinated effort to make sure that we were keeping as many people safe as possible. And that a light bulb went off for me, and I realized that we can do this. It took a pandemic to make us come together to work even harder than we already were, because we were already kind of busting at our tushes to really sort of tackle this. But we really enhanced our ability to coordinate and work harder together. And so I'm really excited to see that once there is a state of normalcy, what does this mean for the way that we enhance the larger system in the response to homelessness?
Thanks for sharing that. I know we get an opportunity to work quite a lot together, and we've seen firsthand what your PATH team is able to do. As we turn to CEO Jim Floros, the County of San Diego has 345,000 recipients of CalFresh now, which is roughly a 30% increase over this time last year. So big jump. Again, so Jim, thinking about giving a brief introduction of yourself, and then also so far, what's really surprised you or stood out as this pandemic has unfolded?
Well, thanks, Omar. So yeah, it's Jim Floros. I'm president and CEO of the Jacobs and Cushman San Diego Food Bank, and the North County Food Bank is also under our umbrella. Career nonprofit guy, 36 years nonprofit, 27 as a CEO. So a bit dedicated my life to this important work. I'm also the chair of the County of San Diego Social Services Advisory Board. So we are deeply in this space. San Diego Food Bank, been serving this community for 4 decades. Not only the leading hunger relief organization in the region, but state officials consider us one of the top 2 food banks in the state, and many consider us the top independent food bank in the nation. So what surprises us the most? I don't know where I even begin. Obviously, just the pandemic itself, I think caught us all by surprise, and no one could have seen that coming. I think the thing that really surprised me is the insane spike in demand. And we literally went from feeding 350,000 people a month to nearly 600,000 people. And that happened what seemed like almost overnight. How that relates to the homeless community, because obviously we do provide a lot of support to the homeless community. We work with 37 different nonprofits in that space, and our job is really more to build their capacity to give them food. But I think the thing that surprised with this big spike in need, how many more people are now heading towards homelessness. And so many people were probably only one paycheck away, one car emergency, one medical emergency from complete devastation. Now the COVID hits. And so I really worry that so many people who are in that gap of heading that way, now that number's just grown so much.
Yeah, it underscores the point that Deacon Jim made about the relevance of poverty and of real economic hardship. And as we turn to Rebecca, again, I want you to introduce yourself to the audience a bit. We know how important extremely low income affordable homes are to our region. That's the very very lowest, sort of up to 30% area median income. I'd be curious, Rebecca, help us understand Wakeland's role in the housing piece, and also sort of your perspective on something that surprised you in the pandemic. You're on mute.
One of these days, that's not going to happen to me. The first time I have to talk. One of these days, I'm going to remember. So first off, I want to give a little shout out to the food bank. You know, since this pandemic has started, my staff have picked up and delivered 105,000 pounds of food from the food bank and delivered it at our affordable and supportive properties. It's been amazing. What a resource it is.
Here to serve.
Also, shout out to Jonathan and Deacon Vargas' staff too have just been incredible throughout this. So again, I'm Rebecca Louie. I'm the COO of Wakeland Housing and Development Corporation. We're an affordable housing nonprofit housing provider. So I'm in a little bit different role. We build and operate low-income housing. We have about 7,500 units in our portfolio, and we also have we've been doing a lot more housing for people who've experienced homelessness in the past several years. So we have about 150 units right now that are reserved for people experiencing homelessness. This project behind me is the Beacon. It's 44 units downtown, all for people who've experienced homelessness, including transition age youth. We've got seniors, you know, really we have a 60 unit project that's completely for formerly homeless seniors. You know, I think the whole pandemic has been extraordinarily surprising, you know, as I said, like one thing after another. What has not been surprising, you know, I was trying to think what surprised me in terms of our residents, and it's what everyone else has said. What's not been surprising is how much this has disproportionately affected the people that we serve, who are already just living on the edge and who, you know, have already been through so much. I'm sorry, I've got to close my window really quick.
No. It's the nature of this world. Yep.
Kids decided right then to start playing some kind of game in the backyard. So yeah, so we, you know, the challenges of doing it makes you wish everyone was housed. Let's put it, that is one thing. I've just felt so relieved for the people we have been able to get off the streets, the seniors who I know, you know, we have seniors who've been treated for cancer while they were living on the streets. The stories you hear, you see people move in with walkers and oxygen tanks. And I just have always, every time I go to the property, I'm so happy they didn't have to be on the streets through this. And I'm so sad for the people that are, as the resources out there dry up. And, you know, you wish that there was just more and more housing to serve the extremely low income and the formerly homeless. And as you said, the real challenge of getting to those bottom rungs in development is, you know, we have to pay a mortgage for everything we build. We have to cover expenses. And when someone can only pay, you know, $200 or $300 to rent, most people who have been homeless, you know, at best are going to get Social Security income. That's about $1,000 a month. If they can pay a third of that to their rent, it's not very much. It's $300 and it's not enough. So we then rely on the local, state, and federal government to come in with what we call gap funding that has to fill that difference. So we end up, I'm doing a project right now that has 11 different sources of funds cobbled together from a bunch of different agencies just to be able to fill that gap and be able to serve people who've been homeless and people who are extremely low income. So it's the shortage of that. So I'll give a quick plug in case I don't later. There is a proposition coming up in San Diego, Measure A, and I encourage you all to look at it, Homes for San Diegans, and vote yes on it, because it's some way that we can build thousands of more units here in San Diego.
Thanks for sharing that, Rebecca. I think it's important for folks to recognize when she mentioned 11 different sources of funding, sometimes folks will ask, well, why does it take so long to build housing? Like this, there's no law of physics that says it should take 3 or 4 or 5 years. The reality, part of the reality is when you've got to cobble together 11 sources of funding that have different time windows, it can be very, very hard to get that capital stack together to make it work. And so there are some efforts to streamline and align to the low-income housing tax credit, but there can always be more that'll help that process out. We're going to switch now to some direct questions to individuals. I'm going to start with Deacon Jim. I think it's useful for folks. Rebecca was just mentoring seniors. By 2035, San Diego County will see a spike to roughly 20% of our total population will be seniors, many of them low-income seniors. We're seeing increases in first-time homeless amongst our senior population. There is no way to get around the critical importance of addressing that older population. Deacon Jim, as you consider your successful street health and incredible therapeutic childcare program, what are the impacts of COVID-19 that you see as sort of most important for people to be aware of? And can you briefly describe those programs or others that are important for you?
Sure, I'll start with the Therapeutic Childcare Center because we've heard of distance learning. A lot of us who are parents, I happen to be a godparent, so I have adult children at this point, but those who have young children, they're struggling with this distance learning and having to juggle their jobs and so forth. And so can you imagine how it is for the parents of those parents who are homeless and their children? It just makes things even worse for them, even more challenging. They don't have the financial resources that others have, the technological resources and the like. And so what we did during the summer, when we saw that really distance learning was going to be repeated this semester, we decided to come up with a method for our children so that they could thrive in this environment. Otherwise, they would just flounder. When you think about it, a lot of our children live in one-bedroom apartments with siblings and the like, and so as a result, they don't have even the space to really devote to education itself and to learning. So we have a virtual learning lab that we put together within our therapeutic childcare. So the children actually come to us, and that's where they access through the distance learning. That's where they access through our technology their teachers and their peers and their classmates and so forth. But it's in a controlled environment. It's conducive to learning. Everyone is masked. There's the distance, social distancing that's involved. We also provide resource teachers within our virtual learning lab area, so that these children, these kids, can really thrive in a not so ideal situation actually for them. So we have about 150 kids right now who are within our virtual lab, and it started at the beginning of September, which is when the distance learning came back into play, and it's been working out tremendously well for them. That also allows the parents not to be concerned about it, so that they can then go into our vocational training programs, which we've had to revamp, obviously, because of the whole pandemic, and the jobs that are out there are different than before. So they can take care of their own needs and be able to go to interviews and the like, so that then together they can get better as a family and be able to go off and be self-sufficient. So that's on the therapeutic childcare, and that's been actually going extremely well. As far as street health is concerned, we started street health in March of 2019. So about a year before the pandemic kicked in. It became even more important during this period of time, during the pandemic, in that more people on the streets, right? And so trying to get them off the streets, get them into the convention center as an example, or start working with them and for the resources that they need in order to take care of their needs. Our street health professionals go out there, and a lot of times they're binding wounds out on the curb. And they are administering, taking blood pressure and administering medication actually when appropriate, because these are health professionals. So they're getting the resources, the health resources that are necessary right there where they are, instead of expecting them to come into a traditional health clinic. About 30% of those individuals who are out in the streets, and chronically so, don't access traditional health clinics. And so this street health has become extremely important in being able to reach these individuals and start working with them and start building a level of relationship and trust, in the hope that then we can get them into a regular setting, both health-wise and otherwise. So those are two that you just mentioned, Omar, very critical actually, because we know actually that kids who come from homeless families are 4 times more apt to be homeless in adulthood if we don't mitigate that, if we don't break that cycle, right? So the wonderful thing about kids is they're so resilient. They may come to us academically delayed and socially delayed and developmentally delayed, but you apply the right resources, and within a relatively short period of time, it's incredible the advances that you make with these children, and that always warms my heart. So, yeah.
That's fantastic, and we really, I mean, it's a powerful thing that I want to underscore. The children who experience homelessness as children are 4 times more likely, that's the number that Deacon Jim just mentioned, to experience homelessness in adulthood. Our ability to address these issues early it really, really matters. As we turn to Jonathan, one of the things we see, the county of San Diego literally houses thousands of homeless people, even before the pandemic, people experiencing homelessness, thousands each year. which surprises people because it's easy to forget how broad the county's reach is. But I know from working with PATH, even this year, PATH has been instrumental in hundreds of unsheltered folks getting into housing. And Jonathan, I'd like to know, as you think about what your outreach workers are telling you about the real needs in the field as it relates to the people experiencing homelessness that you're seeing in the pandemic, if you could share some thoughts about those. And before you answer, I'll just let the audience remind everyone, if you've got questions, please don't hesitate to pop them in the chat. Our Superman in the background, Zach, is keeping a close eye there. So Jonathan, help us understand what's really going on the ground with your outreach teams.
Yeah, I'm going to start off with something I heard David Estrella from the county say about 3 years ago. And he said, you end homelessness through relationships. And, I would say that statement is the core to the way that we provide outreach services. We have a very unique outreach model that we call it a coordinated outreach model, and it's a very neighborhood focused. Because we recognize that if we're really going to be successful in engaging people, we have to have established relationships and have the trust and rapport to understand the needs of the community and of the individual. And so I think our outreach staff have seen, because they've been connected to many of the communities throughout the city limits and East County for some time, that when the pandemic hit, we were already connected the different encampments and communities, that we were able to quickly respond to them and let them know what was happening. And I think that what we learned during the pandemic, is that we were their primary and sometimes the only means or source for information. And so we had to provide to them a lot of education on what was happening. We had to provide education to them on CDC guidelines. But I think what helped make us so successful with connecting with folks and making sure that they were following CDC guidelines, whether they were, remaining unsheltered, that they were practicing social distancing and not going from encampment to encampment, or whether they fell into the 55+ year age and had underlying conditions, that we were developing by name lists of those individuals to make sure that we were keeping track of them, that when there was a room through the county or a room available at the convention center or at our shelter, that we're quickly getting them connected. And so, I think the other piece that helped make our program really successful is that we have a multidisciplinary team, meaning that we have different expertise and professionals that are on the teams to make sure that we have a very a unique lens to understanding the needs, whether it's medical or mental health, or having somebody that can really connect with someone who's unsheltered through a lived experience approach. Our outreach teams also have a lot of flex funds, is what we call, that basically allows for us to use money to help them get to the next place. That sometimes people don't really want to talk about services if they're starving, and so something as simple as us being able to say, hey, look, why don't we go grab you a sandwich? Or why don't we, make sure that we're getting some of your most basic needs met first, and then let's talk. And so I think even some of that flexibility, being able to do that, and then having that same money available to place people in motels or other resources, I think has made us very, very effective. And, being able to work closely with the county, that when the county was working on deploying the public health nurses and others into the field, that we could work with them to say, hey, there's a known encampment over here. Let's get you connected. So I think the fact that we already had a neighborhood outreach model in place made the transition to mobilize quickly that much more easier, because it was business as usual, but adapting to making sure that we were responding around COVID related needs.
Thanks for that. And we've seen it in terms of the county enterprise, our homeless sector, which there's a link in the chat thread for those that are looking for some additional resources. There's a telebriefing that happens. That coordination that Jonathan mentioned has been key as this pandemic has come on. And, in whether it's communications with City of San Diego leadership or others throughout the region, including PATH, and it's been very, very valuable. as I turn to Jim, Jonathan mentioned sometimes people don't want to talk until they've got, you know, their hunger situation squared away, which makes good sense. I mentioned that the county has increased its CalFresh by 30%. It's 40% higher amongst seniors, and CalFresh, for those that don't know, is essentially aid to cover your food expenses. Jim, can you help our audience understand the scope of hunger challenges in the region and any specific issues that people experiencing homelessness are facing with related to COVID-19?
Well, I mean, you know, a big part of our space is really supporting existing organizations working in the homeless space. And I think pre-COVID last year, we gave the equivalent of about 1 million meals to those agencies. And then a big part of our focus is also on preventing homelessness. But you know, food insecurity is a significant problem in our region, and so many people, you know, associate food banks with only working with the homeless. And while we are obviously very actively engaged in that, we estimated before COVID about 1 in 7 people in San Diego County were termed food insecure. It's like 450,000 people. Now, with COVID, we think that number may have maybe doubled. There could be 1 million people in San Diego County that are termed food insecure. And while, you know, we're still serving the people we did before, children born into poverty, seniors, you know, working poor, active duty military, now we're seeing a whole other a group of people who've never ever had to ask for help. People who literally were at one time donors to the food bank, heavy in the service industry, people, you know, restaurants, convention center, all that. And people are very reluctant to ask for help because they're too proud. And so it has been a big part of our messaging is to really tell people that's what we're here for. That's what we signed up for. So, you know, the food bank is here to help and there's plenty of food to go around. So just the incredible spike in demand. And I can't help but thinking, bless you. We can't help but thinking, you know, I've heard from different reports that, you know, for every homeless person you see on the street, there could be 2 or 3 other people that are homeless, but they're not on the street yet. They're either couch surfing, they're, what have you, living in their cars or what have you. So those people are heading towards being on the streets. And so really focusing on trying to prevent those people from becoming homeless. And then behind them, another 400,000, now maybe 800,000 people that are all heading this way. And, you know, something you and I talked about, Omar, is about looking at root causes of poverty and trying to prevent people from being homeless in the first place. That's kind of the space we're living in right now.
Yeah, Jim, that's the repeated call to pay attention to poverty and near poverty is critical, right? 200% of the federal poverty level, as I mentioned, in an expensive place like San Diego, this issue really takes root. And Rebecca, as we turn to you, how has the pandemic impacted Wakeland's existing sort of housing supply, and are there any plans in the pipelines that focus on housing for people experiencing homelessness?
Yeah, so I mean, our existing housing supply, you know, because we do house the working poor and people who've been homeless and people with disabilities, you know, we've been really focused in a way we've never had to be before on helping them get their basic needs met. So my staff have called literally every single one of our residents throughout this on a regular basis and checked on them and said, how can we help you? We've also really focused on trying to help our parents with virtual learning. I mean, I'm overwhelmed with it sometimes myself. I get so many emails. I think, what if English was not my first language? What if I did not have, you know, and it's just been horrible all around because it's really tied our hands. So there's things they need to sign up for on the computers. Well, our computer labs had to be closed down because of this. You need to come talk to property management staff. Well, our property management offices had to be closed for a while. It's cutting off the connections that are so important to keeping people stably housed and also just keeping them healthy. Our seniors, you know, isolation is the worst possible thing for seniors or people in recovery. And so we've really, you know, had to focus on those things in a way we never have before. From a supplies perspective, we have 2 more projects in San Diego that are going to be opening in a year, both partnerships with PATH, actually. So we have the Ivy, which is going to be 52 units, I think, in Claremont for formerly homeless seniors with health conditions. And then we have another one opening in Grantville called Trinity Place. That's going to be another, I think, 74 homes for them. So, it's always, it's a drop in the bucket to need what's needed out there, but we're carrying on. I think it's going to be a real challenge going forward because we do rely on so much local, state, and federal funding. And I think those agencies are going to be, hurting themselves, and really focused on emergency needs. And it's going to be harder, I think, for them to do these big picture funding things that we unfortunately weren't doing 25 years ago when we should have started. So, to really fund the housing that needed to be built, I think it's going to be a struggle, but we'll keep carrying on.
Yeah, it's a powerful set of points that we're dealing with, and I want to just stay with you really quickly because you lifted up something, and we talked about it a little bit earlier, but we hear a lot about affordable housing generally. But we know, as you pointed out, and I think we've heard from others, that there are folks who are just getting that Social Security or disability, and that's all they've got to cover. Can you just give a quick thumbnail for folks to help them understand why the different buckets of affordability really matter when it comes to making projects work?
Yeah, so again, it's that rent collection. So, we're in affordable housing, you can be anywhere from, you can have your rent set for people that are earning, from 0 to 30% of area median income, in which case you're going to need a lot more funding to help fill that gap between what you can pay for with your rent, towards your mortgage. So it's a harder need to get met because we're dealing with scarce resources. It's easier to do projects that serve people that are still low income, but a little bit higher low income. So, the 50 or 60% of area median income. And that's where a lot of projects end up because we don't have that deep level of funding that we need to serve the extremely poor. What's really fantastic for that population is vouchers. So the San Diego Housing Commission, occasionally has vouchers available, rental vouchers. You can get them from the county sometimes does, but they're also in very short supply, but it's fantastic. And then really, man, during a pandemic, have my vouchered projects. I've never appreciated them more because with a voucher, you're getting your rent paid no matter what happens with your income. So if your income goes up, which sometimes it does, people start working, they'll pay actually more to rent and the voucher will pay less. But if your income goes down to a job loss, or, we have so many residents that were hairdressers or, Uber drivers and patching together things. So if it goes down, the property still gets paid the same rent no matter what. So it's just a fantastic source of stability for both the property and the people who are on them. But it's challenging. It's definitely because it takes so much more in resources to serve that population. It's just in scarcer supply.
Okay, thank you for that. And as we pivot to another group question that I'll go to Deacon Jim to start with, and then maybe back over to Jim Floros. I want to just lift up that part of the challenge is that those of us who have to go into communities and work with them early, and I say have to, it's an important part of the engagement process to sit down with members of the community and have honest conversations about what needs to be built. And the reality is that there is a tremendous need for permanent supportive housing, which does come with people who have challenges, whether those be mental health challenges or substance use challenges. And we can't shy away from addressing those needs. It's part of what sometimes delays these things so long. And so I really applaud, Rebecca, you and Pat being able to do these sort of joint ventures to get us done, get us closer. Pivoting now, in California, Black people make up about 6.5% of the population and 40% of our homeless. There is no reasonable way to talk about what we all are doing with regard to eliminating and addressing and reducing the number of people who are experiencing homelessness without lifting up and addressing and thinking about the issue of race and of justice in the context of homelessness. And so, Deacon Jim, I'm curious just how in your work you're seeing those issues and whether there are steps that you have taken or thinking about taking with regard to that equity question.
It's a great question, Omar. And to your point, in 2016 in California, staying with California, more than 60% of Black renters, basically, those who are Black renters who are Black, paid more than 30% of their income in as far as housing was concerned. And 40% of Black individuals and families spend over half of their income. So think about that. I mean, when you're spending that much money that much of your spendable income on just rent. It doesn't leave much for healthcare, for meals, as Jim Floros knows, and for anything else, frankly. And so it presents an extremely difficult situation. And so that's always been a focus of us, the Black community, or not just Black community, but minorities and people of color and others. And in these times, even more so, because if you want to really adopt anti-racist housing and investment opportunities, you have to create more affordable housing. I mean, one of the reasons that we have a homeless crisis in California, and specifically in San Diego, is because of a housing crisis. We don't have, to Rebecca's point, we don't have enough affordable housing. And when you start building this housing, and it takes forever, and you have to jump through so many hurdles. I mean, Rebecca talked about the capital stack. I mean, many of you know, we broke ground on a 14-story building in January. It's going to be 407 units. We'll take about 550 people off the streets when we cut that ribbon in the beginning of 2022. And that building, most people wouldn't know, but that building had to be bifurcated, right? Because we obviously applied for multiple grants, and the state doesn't coordinate one entity onto another, even though they're state entities. I see Rebecca smiling, so she knows. And so at one point we realized, oh, you know what? We were going to be turned down for a $10 million grant because we had applied for another grant for the state. And so we bifurcated the building so we wouldn't lose out on any of the grants, basically, because we needed them both. And so it just shows the complexity of it now. And to your point, Omar, the focus that we have, obviously our focus is homelessness in general, but because it impacts the Black community disproportionately, right? We serve them even more to a larger degree. So you will find that in all of our programs, whether it's housing or any other of our programs, we have a disproportionate number, in a sense, of those who are Black who are being served, and rightly so, because they're being impacted because of past discrimination policies. As an example, redlining. We've heard about redlining. I just wrote an article, an op-ed on redlining, and so these things linger even to today, and they disproportionately affect people of color. So we very much are focused on that. I mean, we're focused on diversifying our board. As an example, in order to deal with that. We have a very diversified workforce, which is good. But it's something, I took the opportunity to take a look at our workforce and make sure that it is diversified, right? And I was pleased with what we were finding. But anyway, the point is that unless you're conscious about this, Omar, unless you're really focused on this, it's just not going to happen. And so, yeah.
Yeah, it's a great point to focus on your own workforce and your own leadership of your workforce. Jim Floros, now switching to you, the equity question, you mentioned poverty. How is it playing out in terms of your work?
One of the things that when I came to the food bank about 7.5 years ago, and my frustration with the hunger community is that everybody was talking about ending hunger, and their way of ending hunger was being more efficient in feeding people. And I'm like, that's not ending hunger. That's just coming up with building a better mousetrap and come up with a better Band-Aid. And you really need to start really focusing on the root causes of poverty. And it's so complicated. And if anyone could have figured out how to end poverty, they would have done it thousands of years ago. But there are things that we know. We know that nutrition-related disease is linked to poverty, and people of color are so affected by that. So, and you can't afford healthy food. Now you're talking about generations of unhealthy people with directly related to a poor diet, which is directly related to poverty. So rampant diabetes, which I know is a major problem in the Black community and people of color, diabetes, obesity, hypertension, heart disease, mental health. They've found that one of the leading causes of mental health later on in life is food insecurity as a child. So access to healthy food deserts where people, a banana costs $5 in the liquor store, liquor store, because there's not access to those healthy food and produce in those neighborhoods. And then let's talk about academic outcomes. Children who aren't eating a healthy diet, the chances of them having a strong academic outcome is going to lead to poor employment opportunities, which means a probability of needing the government or the food bank. So really focusing on the root causes of poverty and social inequity is so entrenched in that. So that is something that we are working hard towards and trying to really find out if we can work ourselves out of a job. Now, I can tell you that the food bank and our workforce, probably 75% of the people are from a diverse background, people of color. Our board working every day to make it even more diverse. So, we want to lead by example. So, we really are talking about a holistic approach, and let's prevent people from becoming food insecure. Let's prevent people from becoming homeless rather than having to treat the problem once it's here.
Yeah, that's a great point. And just Julie Randolph had a question, which I will get to, but I want to just Jonathan again. In San Diego County, African Americans are 5 times overrepresented their population in terms of the proportion of our homeless in San Diego County. How's that impacting your workforce or your work in the community in terms of really focusing in on that equity issue?
Yeah, this is something that PATH is really focused on right now. We actually formed together a diversion, equity, and inclusion committee that consists of various levels of staff and leadership, from case managers to chief officers, throughout the state, to make sure that we're developing a more equitable lens. And I think one of the things that we're seeing and learning is that we're still kind of early on in this journey. Is the challenges around inequity prior to even, someone entering into the homeless system is really the major contributor to homelessness. Is that you're seeing healthcare inequity, education inequity, where our staff are constantly reporting to us that they're seeing discrimination with property owners and property management companies. And so it's something that we're very focused on right now, and very similar to Deacon Vargas. We're really kind of entrenched right now in doing an analysis of us as an organization as it relates to the people that we serve, to the people that we hire, to the leadership level, to our board, and making sure that we are developing a more equitable lens. And what does this mean for us as an organization to make sure that we are advocating for programs and policies that will contribute towards more equity.
Yeah, it's a good point, and I want to see maybe it's great to hear that your organizations are mindful of these things, both in your workforce and your leadership of your workforce, which is something that often gets overlooked, and in how you serve and how we all think about addressing people's needs. Maybe this might be a good Deacon Jim question. I hope to not put you on the spot, but Julie Randolph asked, are outreach organizations finding many people with intellectual or developmental disabilities who are disconnected from services such as the San Diego Regional Center that they would normally be connected to? Are any of you seeing that? We'll start with Deacon Jim.
I am seeing it. I don't know, Jonathan, who does a lot of outreach, I'll let him answer as well, but we do see it. I don't know that we're seeing it any more now than we've seen it in the past, frankly. So I don't know that it has to do with the pandemic necessarily, but we have seen it in the past. And so, and it's how do you address that? How do you engage those people? How do you provide the right resources, right? So that we can, again, start getting them off the streets. So yes, we're seeing it at Father Joe's.
Okay. Jonathan?
Yeah, I think as well as developmental disabilities, we're seeing a lot of people who are undiagnosed, whether it's with a developmental disability or behavioral health needs, and so I think that's been one of the ongoing challenges. I think what we're seeing right now during the pandemic is there is I think that there's a lot of isolation that's happening right now, both in encampments and in shelters, and people who are formerly homeless. That's really kind of exacerbating a lot of the mental health or behavioral health needs that they had. And so I think that this has been a real challenge for us, that we're still looking at how do we continue to adapt our services to respond to this. But I think overall that there is a need, especially with the current state of homelessness with the pandemic, that we mobilize as many services as possible to make sure that we're taking services to people and not expecting them to walk through the front doors.
Yeah, Yeah, no, that's great. We're just closing in on 5 minutes. I will give everybody a chance for one last thought here in a second. First, Jim, Floros, and then Rebecca, though. So I get in the weeds on nerdy questions related to data, and we've got all sorts of gaps that I'm aware of in the work that we do. I'm curious from your perspective, you know, in a couple of sentences, big data gaps that you wish we had more information about. Jim?
Well, you know, one of the things we're working towards, we're trying to bring out to all of our distribution sites, and that is our OASIS program, which is basically we're getting a profile on every service recipient. So we're being able to identify, you know, trends and really social determinants, and then allow us to better serve those people working closely with 2-in-1 and their CIE. So really, data is king, and you can't come up with strategies to serve people if you don't know who they are. So we're working hard on that, and we're gathering some fantastic information to be able to try to improve on our quality of service.
That's fantastic. The CIE, 2-in-1 CIE, the county, Chairman Cox has been a huge investment supporter, the Board of Supervisors in general for a long time. And that's great to hear. I learned something. I'll be following up on that piece for sure.
And if I could just add to that, I'm on the CIE advisory board, and there's a lot of people smarter in that room than me that are experts in data and the technology. But then one of the things on the CIE, Community Information Exchange, one of the members said, unless we have a grassroots organization that can bring names into the CIE, it'll only be nominally successful. And, you know, and people calling 2-in-1, they get put in that. And I realized that's us. I mean, we were feeding 350,000 people a month before COVID. Now it's 600,000. We are that grassroots organization that can bring all that information, capture all that data, and really work close with the county so we can really identify those social determinants.
That's a great point. We're going to do the last one, rapid fire. We got just 2 minutes, about 90 seconds to go. Rebecca, the first you, and then I'll just run right down the line. One call to action. What would you tell the people watching? Please do this. We need your help here. What would you say?
Yeah, I would just say support efforts to build more affordable and supportive housing. So again, Measure A coming up, keep your eye on that, vote yes. And then I think, you know, if something comes to your neighborhood, be it a supportive housing project, be an affordable housing project, be it the ones where people are in their cars, a safe parking lot, you know, don't be a jerk about it. You know, listen with an open mind and know that these are people, and know that especially now that could be any one of us. And so really try to be a good neighbor and be accepting when these things come in, because we waste a lot of time and resources having to, you know, kind of fight communities who don't want this anywhere near them. And I think that people just, that's a way you can really be helpful.
Great point. Jonathan, call to action. What should people do? 30 seconds. We got.
Homelessness is incredibly complex, you know, and, you know, it's impacting everybody differently right now. I would encourage you to get connected to your nearest homeless service provider to get an understanding of what their needs are right now. The pandemic's hitting us really hard. We've had a huge impact on our volunteers that help support a lot of our operations. We've had to take on like additional costs just because of everything related to the pandemic. And so we can use a lot of support, and we really need, you know, the community in that.
We're out of time. Sorry, Deacon Jim and Jim Floros, we're not going to get to you. Lisa's in with the ringer. It was a great panel. Visit the Twitter threads and follow Voice of San Diego. Lisa, take it away.
Thank you again to all of our panelists and everyone joining at home to check out PolitiFest and take away some of their weekend time. I'm really glad to work for a news organization that values coverage of homelessness and issues facing people in poverty. So if you don't already, I would also encourage you to consider signing up for our morning report, which comes daily to keep up with coverage of those things. I actually often quote a lot of the individuals that were on this panel today. But just again, thank you all for participating in PolitiFest, and have a great weekend.